Ever get that feeling like you're just skimming the surface of knowledge? Like there's this whole universe of fascinating stuff out there, but you only get glimpses.
Absolutely. It's like we're surrounded by these incredible mysteries just waiting to be unraveled.
Well, that's what All Sorts podcast is all about, really. We take these deep dives into all sorts of topics, everything from the mundane to the truly mind-blowing.
And we couldn't do it without you, our listeners. You guys send us these amazing sources, these rabbit holes, just begging to be explored.
Seriously, we get so many interesting requests, and this one, well, it's definitely up there in terms of sheer fascination.
Today we are diving deep into the world of ketamine. Buckle up.
Yeah, buckle up is right. Now you, our amazing listeners, you provided a treasure trove of information on this one. We've got excerpts from the NCBI bookshelf and a seriously in-depth Wikipedia entry. It's like you're handing us a map to a whole hidden continent.
And our mission, should we choose to accept it, is to distill all this knowledge, all these insights into something clear, engaging, and, well, hopefully entertaining.
Exactly. We want to give you a solid understanding of what ketamine is, how it works its magic, its various uses in medicine, and, of course, we can't ignore the societal aspects, right?
Yeah.
All the buzz, the controversies.
All that without overwhelming you with jargon or getting lost in the weeds. We'll be your guides through this fascinating landscape.
So ketamine, it's probably best known as an anesthetic, right? But I get the feeling there's a lot more to this story.
You are so right. It's not just about knocking someone out for surgery. It's a much more nuanced story.
Nuance, I like that. Hit me
Yeah.
with some nuance. What makes ketamine so special in the world of anesthesia?
Well, for starters, it induces what's called dissociative anesthesia. Imagine a sort of trance-like state where you're sedated, you don't feel pain, and you have very little memory of the experience.
Like a temporary out-of-body experience.
In a way, yes. But what's really cool is that, unlike many other anesthetics, ketamine actually often stimulates heart function and can increase blood pressure.
Wait, so it kind of gives you a boost while it's knocking you out? That's wild.
It is pretty remarkable, and it generally preserves those vital reflexes like breathing and airway protection, which is a huge plus in emergency situations.
So in a crisis, when time is of the essence, ketamine could be a real lifesaver.
Absolutely. It's often the preferred choice for severely injured patients, particularly those at risk of dangerously low blood pressure.
Because it can actually help raise blood pressure in those critical moments.
Exactly. It's like a 2-for-1 deal. It sedates and provides that crucial hemodynamic support.
And I remember reading that it's extensively used in emergency surgery, especially in challenging conditions.
You're right. Think battlefield medicine, disaster relief, those scenarios where resources are limited and you need something reliable and effective. The Vietnam War actually played a significant role in highlighting ketamine's versatility in those high-pressure settings.
Wow, talk about trial by fire. But it clearly proved its worth.
And its legacy continues. There's a 2011 clinical practice guideline that strongly recommends using ketamine as a sedative in emergency rooms, especially for those painful procedures that need quick and effective relief.
So, when every second counts, ketamine steps up to the plate.
It does. And there's another interesting aspect. Its relatively low risk of suppressing breathing makes it exceptionally valuable in pre-hospital settings. Think ambulances, accident scenes, those situations where stabilizing a patient quickly is paramount.
Makes perfect sense. It's like the first line of defense against pain and chaos.
It's even been found to be as effective as opioids for managing both acute and procedural pain in emergency departments. And that's saying something because they work in very different ways.
Opioids are the heavy hitters in the pain management world, so that's high praise indeed.
And here's a bonus. Ketamine might actually prevent opioid-induced hyperalgesia. That's when prolonged use of opioids can ironically increase sensitivity to pain.
Oh, wow. So it's not just managing the pain, it's potentially preventing a paradoxical worsening of the problem.
Exactly. It might also help reduce post-anesthetic shivering, which can be really uncomfortable for patients recovering from surgery.
Okay, so it's clear ketamine is a powerful tool for anesthesia and acute pain. But what about those chronic pain conditions? The ones that just linger and make life miserable.
It does have a role there as well. It's often administered intravenously for chronic pain, particularly neuropathic pain, the kind that originates from nerve damage itself.
Like when you have a pinched nerve or something like that.
That's a good example. And what's fascinating is that ketamine actually counteracts something called spinal sensitization, sometimes referred to as wind-up.
Wind-up. What's that all about?
Imagine your pain signals getting amplified over time in the spinal cord. It's like turning up the volume on a painful sensation. Ketamine helps to turn that volume down.
So it's not just masking the pain, it's addressing a root cause.
Precisely. Clinical trials have shown that ketamine infusions can provide short-term relief for several neuropathic pain conditions, like those stemming from traumatic spinal cord injuries, fibromyalgia, and a complex regional pain syndrome, or CRPS.
CRPS, that's a tough one, right? Like a chronic, debilitating pain that can be really hard to treat.
It is indeed.
Mm.
Now, the 2018 clinical practice guidelines do offer a more cautious perspective, particularly for conditions like spinal injury pain, mixed neuropathic pain, fibromyalgia, and cancer pain.
So the evidence for ketamine's effectiveness in those cases isn't quite as robust.
That's right. But for CRPS, they found moderate evidence supporting its use. And there's even some evidence suggesting it might provide longer-term relief for CRPS, which is quite encouraging.
So a glimmer of hope for those battling that particularly challenging condition. Now let's switch gears a bit and talk about an area where ketamine is generating a lot of excitement: depression.
This is where things get really interesting. Ketamine has shown remarkable potential for treating people with treatment-resistant depression. These are individuals who haven't found relief with traditional antidepressants.
So for them, it's like a last resort.
In a sense, yes. And what's truly remarkable is the speed at which it can work. Unlike typical antidepressants that can take weeks or even months to show an effect, ketamine can sometimes bring about rapid improvement, even within hours.
That's incredible,
Wow.
especially for those struggling with suicidal thoughts.
Absolutely. It's potentially life-saving in those critical situations. Studies have also shown that small doses of ketamine given during surgery can lead to improved mood in depressed patients afterward. These observations, among others, really fueled research into ketamine's antidepressant properties.
And that research led to the development of esketamine as a specific antidepressant, right?
Yes. It's one of those two mirror image forms of ketamine we mentioned earlier, and the initial thinking was that its ability to block those NMDA receptors was the key to its antidepressant magic.
But it's probably not that simple, is it?
You hit the nail on the head. The fact that other drugs that also block NMDA receptors haven't shown the same consistent antidepressant effects suggests there's more to the story. Researchers are now exploring other potential mechanisms, like ketamine's effect on the lateral habenula, a brain region involved in processing reward and motivation.
So it's less about hitting a single target and more about modulating a whole network of brain activity.
Precisely. It's likely a much more intricate dance of different pathways and neurotransmitters. And the Wikipedia entry also mentions potential uses for seizures and asthma, though the details are a bit scarce in our sources.
We'll have to leave those as open questions for now. Now, with any powerful medication, there are bound to be situations where it's not appropriate, right?
Absolutely. Ketamine has its contraindications. It's generally avoided in people with certain cardiovascular conditions like unstable angina or poorly controlled high blood pressure.
So heart health is a major consideration.
It is. There's also concern about increased pressure within the skull or the eyes, though the research on that is evolving. And other situations where caution is advised include poorly controlled psychotic disorders, severe liver disease, pregnancy, active substance abuse disorders, and of course it's not typically given to infants under 3 months of age.
So careful evaluation by a medical professional is essential. Now let's dive into the nitty-gritty of how ketamine works on a molecular level. We keep hearing about this NMDA receptor antagonist business. Can you break that down for us?
Of course. So picture this. The NMDA receptor is like a docking station on brain cells, a very important docking station.
Okay, I'm picturing it.
This docking station normally binds to a neurotransmitter called glutamate. And glutamate is a major player in all sorts of brain functions, learning, memory, even how we perceive pain.
So glutamate is like the key that fits into the NMDA receptor lock.
Perfect analogy. Now, ketamine comes along and it essentially blocks that lock, preventing glutamate from doing its thing.
So like jamming the signal, disrupting the normal flow of information.
Exactly. And that's what leads to many of its effects, both the therapeutic ones and those mind-altering effects that people sometimes experience.
Right, because ketamine isn't just used in hospitals, is it? There's a whole recreational side to this story.
You're absolutely right. People use ketamine recreationally for its hallucinogenic and dissociative effects, that feeling of detachment from reality. On the street, it's often found as a crystalline powder or liquid, and it goes by a whole slew of names like Special K, even cat tranquilizer.
Cat tranquilizer, that's a new one.
Yeah, there are a lot of colorful nicknames out there, but it's important to remember that recreational use comes with risks.
Definitely. The long-term effects of repeated recreational use are still largely unknown, But it's not exactly a health food, right?
That's for sure. The research is ongoing, but there have been reports of liver and urinary toxicity, especially with regular high-dose use. So it's definitely not something to be taken lightly.
It's important to be aware of the potential downsides. Now back to the science side of things. Ketamine exists in two distinct forms, those mirror images you mentioned. What's the significance of that?
Yes, the enantiomers. It's a racemic mixture, meaning it contains equal amounts of two forms. Esketamine, also known as the S+ isomer, and arketamine, the R isomer. And they're not exactly identical twins when it comes to potency.
Like one is a bit more assertive than the other.
Exactly. Esketamine is significantly more potent at blocking that NMDA receptor, like
Right.
it fits the lock more snugly. That's why esketamine has been developed as a separate medication.
Makes sense. It's all about finding the most effective form. So that blocking action, is that what explains all of ketamine's effects?
It's a major part of the story. Blocking NMDA receptors contributes to the anesthesia, the pain relief, and those psychotomimetic or mind-altering effects. But, as we discussed with depression, there are likely other mechanisms at play too, especially considering that not all drugs that block NMDA receptors have the same antidepressant effects.
It's like there are still pieces of the puzzle missing.
Exactly. Ketamine's a bit of an enigma in that way. And while it primarily acts as a poor blocker of the NMDA receptor, the research suggests it might interact with and inhibit the receptor through other means as well. It's a complex molecule with a complex story.
Complex indeed. Now, we've talked about how ketamine affects the brain, but what about the rest of the body? Does it have any significant interactions with other systems?
It does interact with other receptors, though its effects there are generally weaker compared to its action on those NMDA receptors. It can affect opioid receptors, monoamine transporters, which influence levels of neurotransmitters like serotonin and dopamine, and cholinergic receptors.
So it's kind of like a multi-tool, able to tinker with different systems in the body.
In a way, yes. And while these interactions are generally less potent, they can still contribute to its overall effects. For instance, the interaction with monoamine transporters might be why some people experience a hyperenergic state, a surge in stimulating neurotransmitters, after taking ketamine.
So it's not just about shutting things down, it can also ramp things up in certain areas. Fascinating. What about dosage? Does the amount of ketamine you take directly influence the effects you experience?
Absolutely. There's a clear correlation between the concentration of ketamine in your bloodstream and the effects it produces. For those dissociative and psychotomimetic effects, you're typically looking at concentrations between 100 and 250 nanograms per milliliter.
So that's the sweet spot for those out-of-body experiences.
In a sense, yes. And interestingly, the doses used for treating depression lead to peak concentrations in a similar range, which also overlaps with the levels associated with pain relief.
So a relatively small window for achieving those therapeutic effects.
It seems so. Now, anesthetic doses, those require much higher concentrations, often reaching as high as 60 to 110 micromolar after a rapid intravenous injection. It's a completely different ballpark. And as the concentration drops, people gradually regain consciousness, becoming fully oriented when the levels fall to around 1,000 nanograms per milliliter.
So it's a carefully calibrated dance between dosage and desired effect.
It is. And it's worth noting that the concentration of ketamine in the cerebrospinal fluid, the fluid that bathes the brain and spinal cord, tends to be lower than in the blood during anesthesia. So the brain isn't getting the full brunt of those high concentrations.
It's like there's a buffer in place, protecting the brain from those extreme levels. Now, once ketamine is in the system, how does the body deal with it? How is it processed and eliminated?
Once it's absorbed, ketamine is quickly distributed throughout the body, reaching the brain and other tissues rapidly. It binds to proteins in the plasma to varying degrees, and then the liver steps in, doing what it does best, breaking things down.
The liver, the body's detox powerhouse.
It really is. And ketamine is primarily metabolized into an active metabolite called norketamine, mainly by liver enzymes like CYP3A4 and CYP2B6. Norketamine is then further broken down into inactive compounds.
So it's a multi-step process of transforming the drug into something the body can easily get rid of.
Exactly. Now, the way ketamine is administered actually affects how much of it ultimately reaches the bloodstream.
So taking it orally versus, say, an injection makes a difference.
It does. The oral bioavailability of ketamine is quite low, only about 20%, due to something called first-pass metabolism. Basically, a significant portion of the drug gets processed by the liver before it even has a chance to circulate widely.
So a lot of it gets filtered out right off the bat.
That's right. And this means that after you take ketamine orally, you tend to have higher levels of norketamine compared to ketamine itself. This could explain some of the differences in effects observed between oral and other routes of administration. Most of it is then excreted through urine, primarily as these various metabolites, with only a tiny amount being excreted unchanged.
So it's a pretty efficient process of breakdown and elimination. Now let's talk a bit more about the chemical structure of ketamine. We know it's a chiral compound with those S and R forms. Anything else noteworthy about its chemistry?
Well, from a structural perspective, it belongs to a class of compounds called aryl cyclohexylamine derivatives. And as we've discussed, its chirality is significant. While both the S and R isomers exist, currently only esketamine, the S form, is available as a single enantiomer pharmaceutical.
So the other form isn't used medically.
Not as a single enantiomer, no. While esketamine is generally more potent for anesthesia and pain relief due to its stronger NMDA receptor blockade, there's some intriguing research suggesting that R-ketamine might have longer-lasting antidepressant effects. That's definitely an area that warrants further investigation.
So there might be more to the R form than meets the eye.
Potentially, yes. And it's worth noting that the specific labeling of these enantiomers, whether it's plus or minus, S or R, can sometimes differ depending on whether you're referring to the free base form of the molecule or its hydrochloride salt. It can get a bit technical.
The intricacies of chemistry. Always fascinating. Now, if someone needs to test for ketamine, how is that typically done?
Ketamine can be detected and measured in biological samples like blood, plasma, or urine. This is important for a variety of reasons, including diagnosing drug poisoning, investigating impaired driving, forensic toxicology, and even monitoring drug use in clinical settings. The typical concentration ranges can vary widely depending on the situation. The presence of norketamine, its primary metabolite, in urine is also a good indicator of ketamine use.
So there are reliable ways to determine if someone has been exposed to ketamine.
Absolutely, and that's crucial information for both medical and legal purposes. Now let's shift gears a bit and talk about some of the adverse effects that can occur with ketamine use. After all, no drug is without its potential downsides.
It's all about weighing the benefits against the risks.
Precisely. At anesthetic doses, one of the more common concerns is the emergence phenomenon. As people are waking up from anesthesia, they can experience some pretty strange things.
Strange in what way?
Think vivid dreams, sometimes even nightmares, feelings of unease or dysphoria, hallucinations, and in some cases, a state of delirium. These reactions are more frequent in adults, occurring in about 10 to 20% of cases, but thankfully much less common in children.
So kids tend to have a smoother ride coming out of the ketamine haze.
It seems so. And there are ways to mitigate these psychotomimetic effects. Medications like lamotrigine and nimodipine have been shown to help, and if they do occur, benzodiazepines or propofol can often counteract them.
So there are tools to manage those potential psychological side effects.
There are. Ketamine can also cause involuntary muscle movements, like those jerky, twitching motions called tonic-clonic movements. And while rarer, it can also lead to a more pronounced muscle rigidity called hypertonia.
Not the most pleasant experience, I imagine.
Certainly not. Nausea and vomiting are also common side effects, occurring in about 5 to 15% of patients, but medications like propofol can help with that as well.
Right.
And while ketamine generally supports breathing, there can be a brief period of respiratory depression right after a rapid high-dose intravenous injection.
So careful monitoring is essential, especially in those higher dose scenarios.
Absolutely. And there's this really intriguing phenomenon associated with ketamine anesthesia: near-death experiences.
Wait, what? People report near-death experiences while under the influence of ketamine.
Yes, it's a rather fascinating area of research. Many individuals who have received ketamine anesthesia report having subjective experiences that share striking similarities with near-death experiences.
That's mind-blowing. It makes you wonder about the nature of consciousness and what happens when the brain is in these altered states.
It really does, and some studies have even found a strong overlap between written accounts of ketamine experiences and those of actual near-death experiences.
So it's not just a coincidence. There seems to be a genuine connection there. What about long-term risks? Can people become dependent on ketamine or develop tolerance?
Dependence and tolerance are definitely potential concerns, though the specific details in our sources are limited. It's something to be aware of, particularly with repeated or recreational use.
And we touched on the risks of urinary and liver toxicity earlier, especially with chronic high-dose recreational use.
Those are very real concerns. And it's also worth noting that ketamine can interact with other medications.
So it's not something you want to mix and match without medical supervision.
Not a good idea. Ketamine can amplify the sedative effects of other central nervous system depressants like propofol and midazolam. And interestingly, naltrexone, a medication used to block the effects of opioids, can sometimes actually intensify the psychotomimetic effects of ketamine at low doses. It's a complex web of interactions.
And some medications might even interfere with ketamine's therapeutic benefits.
There's some evidence suggesting that benzodiazepines, for example, might reduce ketamine's effectiveness as an antidepressant. So it's crucial for medical professionals to carefully review a patient's entire medication list before administering ketamine.
Safety first. It sounds like there's still a lot to learn about this intriguing substance.
There is. Research into ketamine's therapeutic potential is ongoing, particularly its use in treatment-resistant depression. It's also gained recognition as a psychoplastogen. That means it can promote rapid and sustained changes in the connections between nerve cells in the brain. And this neuroplasticity is thought to be a key mechanism driving its antidepressant effects.
So it's not just treating symptoms, it's potentially rewiring the brain in a positive way.
That's the exciting part. And on a completely different note, some studies have even shown that at incredibly high concentrations, ketamine can actually kill parasitic worms in rats.
That's unexpected. So it's a worm killer, too.
In very specific high-dose scenarios, yes. But that's not something you'd see in a typical medical setting. Now, ketamine isn't just used in humans, it's also widely employed in veterinary medicine.
Ah, yes, the animal side of the story.
It's a mainstay in veterinary anesthesia, used for both knocking animals out and providing pain relief in a wide range of species. We're talking cats, dogs, rabbits, rodents, horses, you name it.
So it's a versatile tool for our furry, scaly, and feathered friends, too.
It is. It's a key component of the rodent cocktail used to anesthetize small animals in research, and it's often combined with sedatives to achieve balanced anesthesia and effective pain management. Vets also use it as a constant rate infusion for managing ongoing pain and as a primary intravenous anesthetic, particularly in equine surgery. It's a real workhorse in the veterinary world.
So there you have it, ketamine. A truly fascinating and versatile substance with a complex history, a wide range of applications, and a whole lot of potential, both for good and for ill.
We've explored its use in anesthesia, pain management, and even as a potential treatment for depression. We've delved into its intricate pharmacology, its interactions with various receptors in the brain and body, and its fascinating effects on consciousness and perception.
We've also touched on the societal implications, its recreational use, and the importance of responsible use and careful medical oversight. It's been quite a journey.
And this is just the tip of the iceberg. There's so much more to learn and discover about ketamine and its potential to impact our lives in profound ways.
Exactly.
Yeah.
It's a substance that begs further exploration, further research, and a continued dialogue about its responsible use.
And we encourage you, our ever-curious listeners, to continue your own deep dives into the world of ketamine and beyond.
Now, if this exploration into the realm of ketamine has ignited your curiosity, we invite you to illuminate our corner of the knowledge universe by liking, sharing, and subscribing to All Sorts podcasts on YouTube.
We've got a whole library of past deep dives waiting for you, covering a mind-boggling array of topics.
And to stay connected with our ongoing quest for knowledge, and to join us on this endless journey of discovery, be sure to follow All Sorts podcast on X, Instagram, and Threads.
Keep those minds open, keep asking questions, and keep exploring the infinite wonders of the world around us.
Until our next deep dive, stay curious, folks.